Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. October 3rd to the 9th marks the start of Mental Illness Awareness Week. Joining me to discuss the importance of mental health in teens and how to support those with a diagnosis is Chief of Child and Adolescent Psychology at Montefiore Medical Center, Dr. Sandra Pimentel. Doctor, thank you so much for joining me.
Oh, thank you so much for having me. This is a topic near and dear to my heart.
Now, I want to just start talking about the importance of just recognizing mental health or mental illness. Can you just explain, why it's so important that we really recognize, these conditions?
Absolutely. We know that mental health is part of our overall health. And so it's important to recognize mental health because we know that healthy folks do better, they function better. Kids can go to school and learn, adults can go to work and function. And so we know that mental health, as in physical health conditions, really affect our day-to-day lives. And so it's important to be aware when there is mental illness and to be aware of when to get help if there are concerns.
Now, what is important for people in the Bronx to know specifically about mental health?
I think the Bronx is such a vibrant and resilient community. These are and have been clearly really stressful times, even before COVID, obviously, but through COVID and everything that we're experiencing now. And so it's important for the Bronx folks to realize that mental health, as we were just saying, is as important as physical health. And so just as I would tell, my neighbors to keep up with their physical health and go to their primary care physician or get their dental checkups, I would say to pay attention to their mental health and to check in with how they're doing or how their kids are doing. How is stress affecting them? Are they taking care of themselves to take care of the stress levels, to keep that down as well? And so I would encourage my Bronx neighbors to keep an eye on their mental health, to keep an eye on their kids' mental health in the same way that they would any other aspect of health.
Now, what are some ways your organization prioritizes mental health in teens or also in children?
Oh gosh, yeah, I'm at Montefiore and Montefiore Medical Center. I'm in the Department of Psychiatry, and I'm very, very lucky that part of our mission, part of the mission of the institution, really is we are embedded in this community and really prioritizing the health of this community. And again, part of that includes health overall, excuse me, excuse me, and mental health especially. And so in the child outpatient psychiatry division, which is where I am, we have several programs looking at and taking care of the clinical needs of our kids and teens here, including we have an anxiety and mood program that's targeted specifically to address anxiety, mood issues, depression, trauma, a lot of those issues. We have an arts and integrated medicine program that really looks at ways of incorporating arts. We have a garden. We have creative ways to incorporate arts and music into helping some kids for whom the traditional therapies may not work. We have something called the REACH program, which is racial, ethnic, and cultural healing. We know that we've been dealing with, our nation and our community has been dealing with significant stress related to racism, discrimination, and those issues. And really it was born out of the summer of 2020, this program to help teens and youth deal and talk about the impacts of race and discrimination on their mental health specifically, but health overall. So that's our REACH program. So we're really able to help teens from that aspect as well. We have a lot of teenagers who struggle with significant and severe distress, sometimes resulting in self-harm and self-harming behaviors or even suicide and suicide attempts. And we have a program, it's called the Adolescent Dialectical Behavior Therapy Program. And that program is really designed to help our most complex teens who are struggling. And it really is an evidence-based program that helps kids navigate significant episodes of distress, emotion dysregulation, urges to suicide, and things like that. So that's a very important program. We have a program that helps kids with eating disorders. So we have a partnership, our department and the Department of Pediatrics. It's one of the only programs of its kind actually serving Medicaid population. And it's an evidence-based intervention that helps kids with anorexia, bulimia, and some of the other eating disorders that you may have heard of. And what we saw during COVID in particular, we saw soaring rates of eating disorders presenting to our emergency rooms, and not just us, but this was a national trend that we saw. So we already had this program off the ground, off and running, and so we have that
I
program
want
to
to
help.
talk a little bit about, because you mentioned COVID, and like I wanted to ask, in what ways did the pandemic actually affect the mental health of teens and kids? So I'm really interested to learn a little bit more about that now that you brought that up.
Oh God, yes, gosh, yes. So we saw trends of anxiety and depression increasing already before COVID. We saw rates of suicide in certain groups of kids rising, unfortunately, and COVID really sort of blew it all out of the water, quite frankly. And although we don't really know the long-term effects of COVID, we know that COVID itself. Look, even in the Bronx, we know that Bronx was the epicenter of the epicenter, and COVID itself affected Black, Indigenous, and people of color at higher rates than other populations, and certainly here in the Bronx. We saw kids lose primary caregivers or parents to COVID. We saw, in terms of the effects of the early research that we saw in terms of anxiety, stress, distress, we saw that kids from economically disadvantaged backgrounds were more likely to be impacted, not surprisingly. There was a lot more food insecurity, so that, of course, was impacting health and mental health. We saw the social isolation of the lockdown impacting kids and their mental health early on. Again, we don't fully know the long-term effects, but what we do know is that the research continues to be a bit alarming, actually. And we're seeing that if you look even globally, there's a huge study that looked at, across the world, what are the rates of anxiety and depression in kids? And we're seeing numbers as high as double. So we're seeing rates of anxiety and depression as high as doubled in kids and teenagers. And we're seeing it for marginalized groups in particular. And the rates are higher for older adolescents and girls as well. And so those are groups that we're especially concerned about. We're also seeing, you may have heard, the Surgeon General of the United States ring the bell on youth mental health and the alarm on how significant some of the impacts coming out of, this version of the pandemic on anxiety and depression and that early isolation as well. The other thing that I want to make sure we talk about for all the parents out there, this has been such a stressful time. And what the research tells us that parents of younger kids in particular are extremely stressed and were especially affected during the pandemic. There's some research showing that mothers in particular took a harder hit in terms of their mental health. And, there was increased stress, anxiety, depression in parents as well, understandably, with all that they were contending with, in the earlier parts of the pandemic. And now there was increased substance use for many, increased, or lack of exercise or increased sedentary lifestyle for a while, which impacted weight and weight gain. And so all these parts of health sort of intermingling. And what we know is that, kid work is de facto family work. So when a parent is affected, we know that kids are affected. And so the whole household stress level was significantly affected by COVID and still. And again, look, many folks are resilient and they will come out of this. And we have to take care of our most vulnerable.
Now, I really want to know that I heard that a lot of the times, for children, a lot of these mental health conditions can go untreated or unrecognized. Can you explain why that could be happening?
It's a great question. I think, a complex question with probably complex answers. I think in part it's because we don't recognize sort of the potential impacts of mental health in the same way as we might physical health. Maybe there's not enough information on sort of some of the psychological developmental milestones in the same way that there are the physical milestones of when, a child should sit up or crawl and walk in the same way of hitting developmental milestones of a psychological nature in that regard. Really about the issue of screening and are we, do we have pediatricians and primary care folks asking questions about mental health, anxiety. There are recommendations for more and more of that to happen. And we know, like primary care doctors, teachers, they are tasked with a lot of things already. And, really trying to make asking about mental health as natural as asking about other elements of pain or physical experience. So that may be an issue. We know that, marginalized youth and families from, underserved and disadvantaged backgrounds are less likely to get care. So we need to be more direct in getting care to the people that need it. So there are multiple reasons. There's stigma. Some folks don't want to talk about mental health in the same way, or they feel they can't talk about mental health in the same way as they can about more physical health. And so, still, although I think it's getting better, language that destigmatizes mental health, the more people that talk about feeling anxious, depressed, seeking help, seeking support, the better it will be. And, we know even before COVID, there were issues of access, getting specialized help for kids and teenagers from psychologists, social workers who are trained in evidence-based psychotherapies, who are trained in working with the needs of kids specifically, which is a specialty population. We don't have enough specially trained folks to do it. We also don't have enough initiatives in the community. Not everyone needs to come to therapy or needs to do a full set of interventions. How can we get help to people out in the community where they are, or how to get them the resources to address some of the issues of mental health? So answering some of that, I don't know if I fully answered your question, but there are a lot of parts, I think, to the problem.
All right, doctor, thank you so much for joining me.
Sure, my pleasure.
We'll be right back with more